very good morning, everyone. So today in this practical, we are going to learn and practice how to prepare a blood film, a thin blood film. So the purpose of the preparation of the thin blood film is to rule out any abnormalities in the white blood cell morphology. In the end of this practical, students should be able to understand and prepare the blood film thin smear.
Before we prepare our thin blood smear, we have to make sure that our apparatus is ready. So first, we need a sample collected in EDTA tube. And then we need a plastic pasteur pipette to collect our sample. And then we need this special spreader, which is glass with frosted ends. And then we need a clean and clear glass slide. And then we need hair dryer for air dry the smear. DPX mounting media. Cover slip. And slide rack.
To perform a good thin blood smear, you have to have right techniques. As mentioned earlier, you need the frosted end glass. It's a special glass to do the spreading, and a clean glass slide. Now, you grip the spreader in between your thumbnail and your index finger. And then gently grip it to support it. Then take the other clean glass slides, place it in between of your index finger and also your thumb, with your thumb facing towards you. Then you have to do this motion in order to get a good spread. Make sure that the angle is right, roughly about 45 degrees at all time.
To prepare a good thin blood smear, so first we hold the glass slide like this, and we take a good amount of sample and place it at the end of the slide, at least 1 inch from our index finger. And then we grab a spreader with the correct technique that I have mentioned earlier. Place it on the glass slide and pull it backwards until it touches the sample. And then we make sure that the sample is spread evenly at the end of the spreader. After we make sure the correct angle, we push the spreader towards our thumb with a steady motions. So this is the thin blood smear that I have prepared with a good and right technique. So before we proceed with the staining procedure, we have to make sure that our smear is well dry. So here we are going to use this hair dryer, and then make sure it is in a good distance from the glass slide. And then we only use cool air. Avoid hot air because we want to prevent the red cell from crenate. So now we are going to proceed with the staining procedure. So first we place our thin blood smear onto the staining rack, and then we are using Leishman stain. So we flat the Leishman stain onto the blood smear. Make sure it covers all the slides. And then we set the stopwatch at 3 minutes and we start it. After 3 minutes, we are going to add the phosphate buffer at the pH of 6.8 and start it at the edge of the slide. With help from the pasteur pipette, gently air blows to make sure it is mixed well. And then set the timer at 12 minutes and start. When the timing is ready, we are going to wash the stand slide with the running tap water. Gently bring the stand slide towards the running tap water and make sure it is well washed to prevent scab. After standing procedure, you may use 70% alcohol to remove the excess stain from the back of the slide.
Now, after the staining process and air dried, the slides are now ready to be mounted with the DPX. To mount your slides, you need a clean cover slip or glass slides. You need a pasteur pipette and your DPX. It's a special glue to mount your slides. To start the mounting process, transfer a good amount of DPX to your slides. Be careful during this process to prevent you introduce the bubbles. Then place the cover slip carefully on the slides. Slide is now ready to be examined under the microscope. You must make sure the DPX glue is dry. Place the slides on the microscope stage and always remember to start with a low power to prevent you from breaking the slides when you adjust the stage.
There are a few errors that you may encounter during the preparations of peripheral blood smear. So the first error is hairy edge due to broken spreader. So the second error is the thick smear due to excessive sample. So the third error is the narrow smear due to incomplete spreading of the sample at the end of the spreader. So we must make sure that our sample spread evenly at the edge of the spreader before we doing the smear. So the last error is the short smear due to incorrect angle.
A good preparation of a peripheral blood film will help in the patient diagnostic.
Please make sure you do it right. See you in our next practical video.